I'm very happy to have with me a dear student, Dr. Shailesh Salunke. And this is, a series of sessions that we decided we would do with various students, whoever feel like coming up to us and asking us certain queries about their preparation or mindset or strategy. So today in the same series, we have Dr. Shailesh. And let's see what he has to ask me. And I'm really excited to answer his queries as well. But before we start the Q&A session, I would first like to ask Shailesh to introduce himself to all our listeners.
Hello, ma'am. Good evening. This is Shailesh Salunke from MR Medical College, Gulbarga.
Okay.
I've been working in internship right now.
Okay.
Ma'am, currently I need to ask you about how do I give GTs frequently at this time.
All right. So is that going to be your topic for the day, Shailesh?
Yes, ma'am.
Great. And I think it is a very, very important topic as well. It is something that I get a lot of queries about. Yes. So I think today we'll he's decided to ask us questions on grant test, and let's see. What is the first thing you want to ask, Shailesh?
How frequently should I give my GTs?
Okay, so valid. That's a very, very valid question. And I'll just answer it in a little detail, Shailesh. Yes. And, once you ask that, another query comes to my mind. Very often I have it from our undergraduate students. You are an intern, but very often I get questions from undergraduate students. When should we start giving grant tests? So let's take it from that part. When should you start? What should be the frequency of grant test when you start, and how should the frequency change as you go close to the exam? Yes, Shailesh, so I think that will answer your query as well. So I would say that, final year is a good time to start giving your grant test. A lot of you would be feeling that, final year is a big time. So in the fourth year, I would say once you are midway and you have a fair grasp on the clinical subjects, I think one must start giving grant tests. That is a good time. The sooner you start, the better you can get eventually. Now, the first thing, Shailesh, what do you think would be the reason why someone would start late giving the grant test? As a student, if I ask you, what do you think would be the reason?
I have fear that how do I go through that GTs?
Absolutely.
And how do I face that questions and all?
Yes, absolutely. You are bang on right. So yes, the most important reason why, we keep delaying the grant test is fear. And, this fear is of two types. The first fear is that, what if I don't do well? Yes. And you think that it's going to demotivate you and things like that. The second fear, or I would say second way of procrastinating, is that you think you're not ready for it, right? Although you don't really, so, there's a mismatch. You feel that you're not ready. And, when you are ready, you'll be able to do really well. So these are two myths that I really want to counter today. So the first thing is, when do you think will you be completely ready? Any input on that, Shailesh? When can an exam going student be completely ready?
Even if 19 subjects are not covered, whichever subjects we finish, at least 6 or 7 subjects if we finish, that is all right to give a GT and analyze those subjects which we have read already.
Very fair enough, right? So yes, please understand that, even one day before the exam, some of us might feel we are not ready. So do not target perfection. Okay, this is something that I really have to tell you. So when it comes to giving tests, especially the grant test, which is covering all 19 subjects, don't target perfection. It is far better to attempt them and land up doing mistakes so that, you get an insight on where you are and how you can improve. So Shailesh has, I think, put it very wonderfully. He's able to answer his own queries as well. So if you are even prepared with 6 or 7 subjects out of 19, you should start giving the grant test. And that is why I precisely said, Shailesh, that once you are midway in the final year, you should absolutely start giving it. Because, you know, by that time you would have covered some amount of clinical subjects, and you would have covered, you have some idea and background about your pre and paraclinicals as well. So it is a good time to start the grant test. Now, coming to the query that Shailesh had asked me, the frequency. Okay, now initially when you start giving the grant test, let's say in your final year or even at the beginning of your internship, once a month is good enough to have a start. Right, Shailesh, if I may ask you, beta, at what part of your internship are you currently in?
I'm about to finish my internship in May. I finished, and
Great.
currently I'm doing T&A, NEETPG T&A.
Right. So that's so good. So now I know what he's exactly trying to ask. So he's an exam going student in this year itself. The exam is going to happen in the month of May. So as I said, when you begin, that is in towards the end of your final year or the middle of your final year or even the beginning of your internship, once a month is what you should start with. And do not try and practice a lot of grant tests in the beginning. Yes, this is also a mistake some students do. They would say, okay, I will do a grant test every alternate day. So no, at the beginning, what I really want is consistency in giving the tests and giving yourself adequate time to improve between the two grant tests. A lot of us feel quantity is more important, right? But I would say no. Quality of the work that you're putting in will actually be more important for your final marks. So, you know, when you begin, it's okay for once a month. Let's say now you're in the middle of your year. When I say year, I mean the exam going year. For Shailesh, it could be middle of his internship as well. So when you're in the middle of the exam going year, you can increase the frequency. Okay, so you can make it once in 15 days as well. Okay, and as you approach close to the exam, say 3 months are left for the exam, then we have to further increase the frequency. But the frequency will depend upon your baseline level. Now, let me try and explain you what I mean here. For example, Shailesh, if you don't mind me asking you, beta, when you started, let's say at the beginning of your internship, what was the number of correct questions that you were able to get out of 300 in a grant test?
I used to do around 120, 130.
Okay. And what about in the middle of the year?
Gradually, they are increasing to 140, 143.
Great. All right. So this is how you have to decide. By which I mean, suppose you're in the middle of the year, exam going year, but your number of correct questions is, let's say, less than 120. Okay. And I'm talking about middle of the exam going year. So if your number of correct questions is less than 120, I strongly feel that then you need to work more on the content. Okay. Because this means somewhere deep down, the content is probably either a little superficial or a little weak. And that is why the number of questions is less. Correct. So here for these students, doing too many grant tests would actually not build up the score. But if you are 120 and above in the middle of the exam going year, that is, when I say middle, I mean about 6 left for your exam, then I said increase the frequency, because now you need to focus on special areas which will help you bring up your score, because you're sort of static. And then in the middle of the year, increase the frequency to, as I said, once in 15 days. Now, once we are further close to the exam, let's say 3 to 4 months before the exam, and you are around, let's say 130 correct questions, increase the frequency further. So 3 months to the exam, you should start or try to give it once in 10 days. Okay, once in 10 days. And now, Shailesh, once we are really close to the exam, like a month or 2 months are left, it's a good idea if you can give weekly grant tests also, right? And as I said, this frequency, how much should you increase your frequency will depend on your baseline level. So, you know, sometimes you feel it is a random talk and, you know, the advice will work for everyone. No. So I'm therefore answering your first question in detail. that the frequency should be decided upon based on your number of correct questions. Yes, because you really have to see, are you weak in the content part, or are you weak in the application part or time management part, or ruling out options, which is called as the MCQ skill. So less than 120 means you have to work on your content. So increasing the frequency of grand tests would not really greatly help at that level. Maintain a consistency, do it every once a month or once in 20 days, but work more on your content. If you're above 120 in the middle, then definitely improving or increasing the frequency will tell you the special areas that you need to focus on so that your score will improve. Right, Shailesh? So I hope I was helpful here to sort of tell you in detail how to manage the frequency of grand tests.
Yes, really very helpful.
Okay.
How often should I review GTs? And after giving GTs, I feel like when the scores are not consistent, at 1 minute of time, like 140, I will go, or
Okay.
other moment of time, go 130, 125, like that.
Okay.
So I feel like some depressive sort of things.
I understand. So Shailesh, I will divide your question into two parts, beta, right? And I'll answer them like that only. So your first was that, you feel that the consistency is not being maintained, right? Sometimes you do really well and it reaches 145, and sometimes you drop down to 130 also, right? And that is absolutely normal to happen, Shailesh. So I have to tell you that you don't have to lose, your confidence with that. See, what happens is the grand tests that you will do will be of different levels as well. By which I mean, sometimes it might be on the relatively easier side, and sometimes it might be a little difficult. So that is why a number of correct MCQs is going to fluctuate. So now, how to tackle this? Now, you will ask me, ma'am, how will I get to know this? Because, I am not the person who can judge whether it is easy or difficult. So that is also right. So how do we find out? Suppose you are doing, right, let's say on an average, I will say that your score varies between 120 to 140. And let's say the average score is 130. Okay, Shailesh? Now, what I want you to do is, suppose in one of the GTs you have done exceedingly well, and let's say you have reached 145. Yes. So instead of being very, very happy, I know you should be happy, but you have to always stay grounded. What I want you to do is, see the number of correct questions that is done by rank 1. Okay. Don't get bothered that he's got rank 1 or she has got rank 1. I just want you to see the disparity. Okay. So let us say your number of correct has gone up, but also the total number of correct of the rank 1 has also massively gone up. What does that tell you, Shailesh?
It feels like the paper has been somewhat easy level.
Yes, absolutely. Now you're getting the, the detailed aspect of it. So which means your doing well was a relative phenomena. It was not actually because you have improved. Do you understand this? And this is something which is going to happen in the real exam also, beta. So if you have talked to your seniors, Shailesh, you will realize that last year when the paper was easy, the number of correct questions has jumped. And people with even, 135 correct could not get into the good rank zone. Yes, do you agree with me?
Yes, ma'am.
So always. And similarly, you should do it on the other side also. Let's say you were on an average getting 135 correct, but today's GT, let's say you've got 120 correct, right? What would you do? Do not get disheartened. All right. I want you to do the same thing. Go back and see the analysis of what is the number of correct questions by rank 1. Maybe the total number of correct, if they were usually around 150 or 160, let's say, now they've come down to 150. What does that tell you?
Is somewhat tough type of hard type of paper.
So, this kind of an analysis will help you in two ways. Number one, it will prevent you from going into the overconfidence zone, and it will also prevent you from feeling disheartened. So somewhat you will always stay grounded. The second thing is, it will also tell you the gap. Okay, the gap between you and, let's say, someone who's done maximum correct, and that gap is necessary to know a lot. This is something that most of the students don't do. Yes, what does it tell you, Shailesh? Let's say you are at 140 correct, and let's say rank 1 has got 165 correct. What does it tell you?
I have to look, I have to analyze the questions which are made wrong, subtopics or topics,
so which means
whichever.
yes, that there is a gap of about these 25 questions between you and rank 1. Yes, now let's presume that rank 1 is a brilliant child. All right, there are always going to be those extremes in the curve, right? So let's say, acha chalo, the child must be very intelligent. So let's give a little discount. Let's say for average student, but you should have tried to reach around 155. Yes. So this is what you have to know, that this is where I am, but this is where I can definitely go. Yes. Don't give yourself, targets which seem impossible, but you should always give yourself some realistic targets. Yes. So you should know that I have to bring this score. If I'm on average around 140, I have to try and bring it to 150, 155. It will fluctuate depending on the paper, but yes, I have to try and reach there. So this is the kind of analysis I need from every child. A lot of times when you students do an analysis, can you tell me, Shailesh, what are you focusing on? Do you focus on your score, or do you focus on number of correct questions? When you see the result, what do you focus on?
I used to focus on questions which I have made correct number of questions, ma'am.
Yes,
and then I would compare to the topper score, ma'am.
Yes, that is the way it should be done. Please don't see your scores. It doesn't matter. What you need to focus on is the number of correct questions. Maintain a tally, okay? Over a period of grand test, maintain a tally and see that what is your average score and where do you fluctuate. Yes. So this will give you a fair idea ki in the competition, where am I and where can I possibly go? Yes, Shailesh, this is the first analysis I want you to do when we talk about grand tests. So if you keep this thing in mind, Shailesh, it will help you on both ends. On some day when you reach 150, you will have confidence, but it will ensure that you don't get overconfident. Yes. And also on some days when you reach 120, it will prevent you from getting disheartened. Yes. Will you try that for me, Shailesh, next time when you see your result?
Yes, I'll surely try.
Yes, do that. So it'll keep you grounded, beta, and it'll help you focus more. Yes. What was the second query that you were asking about analysis, Shailesh? I forgot.
How do I review GTs, ma'am? Like, how do I analyze the GT levels?
Okay. Is there a method that you are currently following, Shailesh? Maybe I can listen to you first and then I can give my opinion on it.
Ma'am, I'm currently doing the 3-column strategy, ma'am.
Okay.
Which is first column where I do wrong subjects or wrong subtopics.
Okay.
I will note it down. Then second column would include volatile subjects,
okay,
which I tend to forget very easily.
Yes.
And third column, which will include morely, which I don't know anything about that topic.
Okay. So your potential areas of improvement, right?
Yes, ma'am.
Great. And do you think that over the last few GTs, Shailesh, the 3-column strategy has helped you?
Yes, ma'am. It is working.
Okay, great. So now I'll this 3-column strategy video I did, I think somewhere in the lockdown, because that was again the time that we were getting a lot of queries on how to improve the GT score. So now I will just, expand and tell some things in detail and probably help you in improving further, Shailesh. Now, yes, 3-column strategy is an excellent way to analyze your grand test paper. But I would say, Shailesh, at your level now, when you're close to the exam, you should, it is still the 3 columns, but instead of focusing on your bottom 3 subjects, you should focus on bottom 5 or bottom 6. Yes, so this is something again that I have to tell you. Now, when you look at your GT, what I tell my students is, Shailesh, I hope my voice is not breaking, beta. Is it coming fine?
Yes, ma'am.
Okay.
You are audible, ma'am.
Okay, perfect. So what I want is that when you begin with your grant test, a lot of students are only giving grant tests, and then they are seeing the results, and then they either feel very sad about it and they don't feel motivated to give the next one. So there is a gap, and it's a vicious cycle. So please understand one thing, that more important than giving the grant test is actually the analysis of the grant test. Yes. By which we mean you have to actually find out where you are lacking, and only if you focus on that will you be able to increase your score. Otherwise the score gets static. Now when you begin with the grant test, that's when I had talked about the 3-column strategy. So which means for beginners, where they feel that, ma'am, there are 19 subjects, I haven't done all 19 of them as of now, so how do I do my analysis? So what I say for beginners is that, let's say out of 19, you feel you are prepared with 7 subjects or 8 subjects, whatever number it is. Okay. In the beginning of the session, out of the subjects that you think you are prepared with, okay, let's say there are 8. Out of these, find out the bottom 3 subjects, by which I mean 3 subjects that you think you were prepared in, but the number of correct questions is really low, or the number of wrong questions is very high. And it should be a percentage of the total, by which I mean, because medicine is a very vast subject, so there are going to be more questions in the grant test, and the possibility of number of wrongs will also be higher. Am I true, Shailesh? If you just see the number. Yes.
Yes,
so
ma'am.
Right. So what I want is, when you want to see the bottom 3, see the percentage. For example, maybe you have done 6 questions wrong in medicine, which has a total of, let's say, 30 questions, and you feel that 6 is a big number. On the contrary, let's say in radiology, out of 5 questions, you have done 3 wrong. So the number of questions that is more wrong is more in medicine. But can you tell me, Shailesh, which subject should you focus on currently?
Medicine.
It's the
medicine, ma'am. I should focus on medicine.
नहीं, तो यही मैं bias हटाने की कोशिश कर रही हूँ, Shailesh. See, in medicine, you got 6 questions wrong into 30. Out of 30, the percentage is still less. The number of questions is more. But in radiology, you did 3 wrong out of 5. The percentage of wrong is very high. Yes. Otherwise, what will happen is you will always keep studying medicine. Don't you agree with me? Same way also for surgery, because the number of questions is so much, obviously the number of wrongs will be higher. So instead of only focusing on wrongs, when you are trying to find out your bottom 3 subjects, see the percentage of wrong questions. Okay, Shailesh?
Yes.
Right? So now, at the beginning of the session, you're trying to see your bottom 3, which means 3 subjects that you feel you are well prepared with or prepared with, but you have done more percentage of wrong questions. Now, I want you to write down in the diary. For example, let's say I have done grant test number X. It could be whatever grant test. And in the X grant test, your, let's say, radio, let's say surgery, and let's say physiology are in the bottom 3. Right? Now, what do we want to do next? Once you have seen what are your bottom 3 subjects, the next thing I want you to do is make these 3 columns that Shailesh was talking about. Yes. So you make a paper, divide it into 3 columns. You take a paper, divide into 3 columns. In the first column, you write down the topics that you have done wrong, right? And here I want you to focus on the ones which you did wrong because of application, which means you knew the concept, but somehow when it was asked in an MCQ, you did it wrong. The second column, you could put the questions you have done wrong because it was a volatile thing. Maybe in medicine, they had asked some drug and you forgot the name. Okay. Or in physiology, they asked something factual, numbers or percentage, and you forgot that. Yes. And in the third column, you write down the questions you've done wrong of topics that you did not know at all, which means probably you thought that this topic is not asked, But now once you start appearing for the test, you realize this topic is also asked. Yes, Shailesh, am I clear on that? How to make the 3 columns?
Yes, ma'am.
Okay. Now, what are you going to do with these 3 columns? Now, the most important aspect is once you have done this analysis, before you give the next grand test, okay, which is, let's say, a month later, between these 2 grand tests, I want you to work on these 3 subjects. And out of these 3 subjects, I want you to only focus on the topics that you have written in the 3 columns. Which means, Shailesh, would you be reading entire medicine or no? No, right? So no, you're not going to read entire medicine from between GT1 and GT2. You will only read those topics which you have put down in column 1, column 2, and column 3 before you give the next grand test. Similarly, you will not read entire physiology between the 2 grand tests. You only try and cover the topics that you have written in the 3 columns. The same holds true for radiology, right? So between the 2 grand tests, you have to work on these 3 bottom subjects. So this is what is the 3 column strategy with 3 bottom subjects. And this is what I want you to follow from the beginning of the year up till the middle of the exam going year. Yes. Shailesh, can you tell me what is the problem you face in this strategy? Because I want the student to speak it out and then I will tell you what to do about it. Tell me.
Currently, exam is at May 21 now.
Yes.
So I have very less time to review my GT. That is the main thing I'm facing.
Yes. So the first thing is the 3 column strategy has to be modified a little in the last 6 or 3 months before the exam. That is first. Second thing, the students sometimes get motivated. They will say, ma'am, I read medicine, radio, and physiology. So in the next grand test, I have improved those. But now my surgery and orthopedics and pharmacology have come in the bottom 3. What do I do now? So tell me, Shailesh, is it a good thing or is it a bad thing?
For me, it's a bad thing.
No, it's
I
not a
don't
bad
remember
thing.
those topics.
Let me tell you this so that you again don't get disheartened. It's a good thing. You focused on medicine, radio, and physiology, and now you've improved the number of correct questions in these 3 subjects. It is always better to have some other 3 now next time in the bottom 3. How will this help? So this will help you in keeping in touch with all 19 subjects in rotation. आप समझ रहे हो? Otherwise, Shailesh, क्या होता है? What students do is that if they are preparing for 6 months, 3 months they will read only medicine, surgery, and in the remaining 3 months they will try and finish the other 16 subjects. ऐसा होता है कि नहीं होता है? Tell me. है ना? So it is always better that you have different subjects coming in the bottom 3 so that you are not leaving behind any subject. You are continuously, rotationally revising something or the other from all 19 subjects. So this will definitely improve your scores. And secondly, sometimes the exams are really skewed, Shailesh. If you realize that sometimes INICET ka distribution is really skewed, by which I mean in one session, they will ask 1 or 2 orthopedics questions. And in the next session, you will see 9 or 10 questions coming. Yes. So what does it tell you? That
every subject is very important to focus on.
So you cannot do a biased study. You have to ensure that you're working on all 19 subjects and you're prepared for any kind of change in pattern. Yes. So every time a new subject should come in the bottom 3 so that you are rotationally doing all subjects. The second problem is what Shailesh said, that ma'am, now the exam is in 2.5 months. Yes, or approximately 3 months. So ma'am, now what do I do? Because I have to be fast. So he is very right. So now once you are fast, or I mean, when you have less time, you're close to the exam, you should actually change your strategy from bottom 3 to bottom 6 subjects. Shailesh, are you getting me?
Yes, ma'am.
The number of subjects that you would be revising between the two grantors has to increase. And that will only be possible if you precisely know what topics you have to focus on. Yes. So Shailesh, this is one change beta that I want you to do. Now follow bottom 6 subjects and do it in a very precise manner. I'll repeat this. What do you understand by precise, Shailesh? Can you help me? Help our listeners understand what do we mean by precise analysis?
Suppose if I give any GT,
right,
I will note out wrong questions and the topic, only the topic name which I have made wrong.
हाँ, उसमें भी ना शैलेश, even the topic should not be a generalized topic. For example, in medicine, if you have done 3 questions on arrhythmias wrong, don't write you have to read entire arrhythmia, because that is going to take a lot of time, and that is where you feel that revision is not possible. So what I want you to do is, I want you to pinpoint the areas in arrhythmias that you have done wrong. Yes, maybe you were more confused about the ventricular arrhythmias, or you were more confused about the antiarrhythmic drugs. So be very, very precise. The more precise you are in making your 3 columns, believe me, the more effective your revision will be, more subjects you will be able to revise, and it will be very, very high yielding, and it will definitely improve your score, Shailesh. Will you try that also? Do that change also for me now?
Yes, ma'am, I'll try.
Yes, so increase the frequency of grant test for you, Shailesh. Second, change the bottom 3 subjects to at least bottom 6 subjects. Third, when you're making the 3 columns, be very precise in what you are weak at, and do not write the name of the broad topic. Okay, Shailesh?
Yes.
So does that help you in what kind of changes you should make if you are stuck at a score?
Yes, ma'am.
Okay, tell me, if you feel this question is answered, what is the next thing you want to ask?
After when I go through the review and analysis,
yes,
after that I feel like if I give 2 GTs, what will be the interval between them? Then
right.
I will get, if I give the GTs very frequently, I will get less time to analyze them.
Yes.
So how do I go
exactly, Shailesh. So what I said, for this purpose, what you should see is number of correct bache. So if your average number of correct is around 135, it is a good idea to give it once in 7 to 10 days, not more frequently. Okay, so that you have good time to revise those specific topics between the 2 grant tests.
Yes.
Okay, and if you get even better, for example, you consistently reach 140, 145, you can now do it once every week also. So abhi I'm saying week to 10 days, which means around 3 grant tests in a month. Isme na, Shailesh, you can actually repeat a grant test also, by which I mean, suppose you are doing the current month grant test, and let's say you started in the last year somewhere around June. So you can actually repeat that June grant test again as well, because grant tests are going to have topics which have a very high probability of being asked. So those topics you have to repeatedly hammer, and you have to ensure that you're very thorough with these topics. Okay, bacha?
Yes.
Right. What else?
There will be some topics like memory based. How do I recall and how do I go through that?
Okay, perfect. That is again a very important thing, because I think all medicos face this problem. We have a lot of memory based or volatile things as well. So I'll tell you, Shailesh, what I used to do when I was preparing, and I still do when I study something. There is a diary that I keep. So there are actually, I would say, you have 19 subjects. I say students should make 3 more diaries. Don't get scared, okay? The first diary is your GT assessment diary, right? Where I said you are doing those 3 columns. The second diary is your volatile topic diary, where I don't want you to write the topics. What I want you to do is this. At night before going to sleep, Shailesh, today only you start this, and then you give me a feedback on it, okay? Take a fresh copy or a diary and write down any 10 memory-based things that you can recall from a particular subject. Okay? For example, today, what subject are you studying, Shailesh?
Physiology.
Perfect. So physio has a lot of volatile things, right? So at night, when you are done with your, throughout your day's study, before sleeping, open your diary, a fresh diary, and write down any 10 points that you remember, which were memory based from today's study. Okay, those could be any 10. Yes?
Yes.
And you do that consistently until your exams. Okay? Every day, only 10. I'm not increasing your workload a lot. It will take hardly 10 minutes to write down those 10 points. Hai na? And
Yes,
when you are consistently done with, let's say, 30, 40 pages, now what you can do is, apart from writing 10 points, spend 10 more minutes in the night. So initially for 1 month, I am spending only 10 extra minutes before the sleep. Now after 30 days, I am spending 10 more minutes, or a total of 20 minutes. In first 10 minutes, I can write 10 volatile things. And tell me, Shailesh, what do you think I want you to do in the next 10 minutes?
You will recall that whatever points I have written.
Yes, excellent. So sirf 10 minutes laga ke, open your diary and see the first 10 points that you had written. And believe me, if you do it consistently, you will not have to search important points, volatile points from anywhere else. Not just that, these 2 copies that you are doing, they will greatly help in increasing your scores. Okay? Now, Shailesh, you must be thinking, ma'am is giving me so much of homework to do. Tell me, what is the 3rd copy for? So I've done your 20th copy. I've done your 21st copy. What is the 22nd copy for?
Flashcards.
Your 22nd copy is to tell you how good you are. Okay, so in that last copy, every day, I want you to write one good thing about your own self. Yes, any strength that you feel you have, or any one good thing that you think you did today. It could be as something even as random, like today I completed whatever targets I had given myself. And that is, believe me, that is a strength. A lot of people cannot meet their own targets. So, next time when you feel a little underconfident, open this diary and see the good things about yourself. Yes? Anything that you feel positive about yourself, I want you to write that also. Because हमेशा सब लोग हमेशा आपको एक डायरी बनाने को कहते हैं जिसमें नेगेटिव चीजें होती हैं, है ना? Your weakness, your weak zones, your volatile things. But I think to balance it out, we should also have one diary which tells us how good we are, how, we have faced challenges and we've come out from each one of them. Yes, will you do that as well, Shailesh? For me.
Yes, ma'am. Reward diary.
Yes. So you have to know that you are good enough for any your way.
Yes, ma'am.
Okay, Shailesh. Anything else, beta, that you want to ask?
Currently, I am unbiased, ma'am. Like, what should I read? What should I leave the subject?
Okay.
How should I go through the subjects?
Shailesh,
I am doing currently.
Currently, what, beta?
P&D, NEETPG,
yes.
2020.
Yes. So, Shailesh, what I would say is, I'm sure by now you are in your revision phase. And that's what you're trying to tell me, that everything seems so vast that you don't know where to start from and how to go about it. So, Shailesh, what I would tell you is that now about 2.5 months are there, right? A little more than that probably. And you can easily do 3 revisions. You know how? March, you should plan 1 revision of all 19 subjects. April, you should plan 1 revision of all 19 subjects. And May, 1 last revision of again all 19 subjects. Yes. So, give yourself an average of 30 days and then divide those 30 days into for those 19 subjects. For example, for big subjects like medicine and surgery, you can keep aside, like, let's say 4 days. Okay. For mediocre subjects, and I mean with the volume, right? For like obs and gynae, you can keep aside, let's say 2.5 to 3 days at this phase, or 3 days. And for short subjects, not more than 1 day, right? And so like this, over a period of 30 days, plan how you will revise all 19 subjects. It is very important to stick to it. For example, if you have planned that you will finish medicine in 4 days, you have to move on to the next subject, irrespective of whether you were able to revise entire medicine or not. Okay, that's very essential. Second, to ensure that you're able to finish things in a stipulated time, I would say do not start reading your notes from the first page all over again, right? So as you said, you're a TND student right now, Shailesh. What I would suggest is open your TND paper. Let's say you want to revise medicine. Okay, so if I was in your place, I would open up my medicine. I think you have 3 papers or 2 papers.
Yes.
So I would open those papers and I would see what is the topic in the first paper. And I've seen only the topic. What I do is I go back to my notes and read that topic first. Then I go to question number 2. What is the topic? Read that topic. So this is a retrograde approach, right? So instead of reading your notes all over again, like the first reading, take up your TND paper, see the topics, and then read those topics very thoroughly from your notes. And like this, finish your revision of 19 subjects in a span of 30 days, once in March, once in April, and then a fast revision in May. Yes, Shailesh? Yes. So I hope if you sit down and plan it up, you'll definitely be able to do it. It is very essential, beta, कि जब हम पढ़ाई कर रहे हो, let's not do it randomly. It should be planned. Like, planning is very, very important when you have to cover, big things. Okay.
Yes.